with everything going on, and we're very fortunate to have you.
Well, I appreciate having me, Senator. Thank you very much. It's great to be here, and it feels like forever ago since I saw you in person, and it wasn't really forever, but it was March. So it's been a long time, and there's been a lot going on since we all had to leave our advocacy work at the state capitol in person. And AARP Connecticut, just for those who don't know, we are a social mission organization with a membership. We are a nonprofit and nonpartisan. We have offices in every state, the Virgin Islands, DC, and Puerto Rico. And there's a me in all of those states, a state director leading the advocacy and outreach work that we do in community every day. We've got about 600,000 members here in Connecticut and about 38 million nationwide. And we have flipped the script on how we do business since we had to all start quarantining. And that has been, the mission hasn't changed, but how we do business has gone, like everybody else, to virtual. And all the advocacy work we were doing, we really had to switch a lot of things up, work a lot more on nursing home issues, for instance, work a lot more on federal stuff that we never in a million years thought we'd be working on. So it's been a learning experience. Our volunteers and our members and my staff have really gotten themselves active and have been advocating on a lot of different issues, both, in terms of executive orders and trying to keep the legislature informed of all the different resources we have for our members and non-members, so that everybody can kind of have all the information they need from a reliable source at their fingertips. And so we're acting as a convener and as a force for making sure the age 50 plus and their families are represented. And then we are, also just trying to figure out how to bring a little bit of normalcy and fun with purpose back to our virtual programming.
So, what specifically is the AARP doing to help, inform family members and individuals at this time?
Yeah, so one thing that we started probably maybe the first week of April, I have to think back, maybe the last week of March, was a weekly telephone town hall that is open to anyone across the country to join for free. And I will give the number a couple times, but the number, it's every Thursday at 1:00. And the phone number to call in toll free is 855-274-9507. And so the topic varies every week from, last week it was Susan Lucci of, television.
Wow. Yeah. All my children.
Yeah. And our CEO, Susan Lucci, has a mother, I believe, who's in a nursing home or a skilled facility of some kind, and what she was coming at it from a caregiver perspective about what that has meant to her. And then we've had on everyone from the Surgeon General of the United States to people from CMS, financial experts, folks from the medical field, trying to bring the latest and most up-to-date and accurate information we can to everybody. So again, this is open to anyone. It's toll-free, and it's every Thursday at 1 p.m. And it's 855-274-9507. But then we also started aarp.org/health. And there you're going to find all sorts of information about the coronavirus. You're going to find recordings that you can listen to on demand of previous telephone town halls. And then we've done things at the state level. So for instance, we have had, I think, 4 or 5 telephone town halls since we all sort of started staying safe and staying home about the coronavirus and what it means to people in Connecticut and their families. So from the governor to the state epidemiologist to both members of our, both U.S. senators and 2 members of Congress. Yeah, I think that covers them all. And then we bring on other people to take on things like social isolation or the issue of nursing home patient rights, and of course the medical perspective. So if people have questions that are really about testing and about antibodies and about what's safe and what's not, we've got the medical experts on. All of those are available on our Facebook page to listen to on demand as well. So, and that's AARP-CT.
Okay, and that would have like all the Facebook Live. So
Yep.
you'd have not only the congressional delegation, but any other experts that you may have had on, and people can go and look at that and maybe be able to see things that might be of interest to them.
Exactly. So for instance, I'm losing track of time like everyone else. Every day is Tuesday world, right? But last week, I think it was maybe the week before, we had on some experts on fraud and how when you're in a position of social isolation or panic or the unknown, how you may be more susceptible to fraud, and the fact that, scammers read headlines also, and they use those headlines to take advantage of people. And so we're seeing a big uptick in coronavirus related scams, in scams related to the stimulus checks that came in, things like that. So from that to, we had on an expert from the New England Assistive Technology Center by the name of Chris Thompson. And he talked about the ways that you can use off-the-shelf smart home technology to stay connected in a time of, physical and social distancing. So those are some examples.
So you are seeing an uptick in fraud and abuse of that nature.
Yeah, and I just went to our Facebook page. Not our Facebook page, but our website, and saw a new updated scam alert. And people just, it's hard to compete with people who are looking every day to take your hard-earned money and put it in their pocket. So, most of us don't sit around trying to think about all the ways someone's going to scam us. So when something new and that, again, that heightened state of concern or awareness or loneliness hits, the fraud, the susceptibility to fraud increases. And so we have seen an uptick. And there are also one recent study we did, which oversampled Connecticut. It was a national study. I thought was interesting, showed that people are using the apps to pay, like, people remotely for things a lot more. And I mean, we all know that you're sitting home, you're seeing the UPS guy and the FedEx guy more than ever, right? Because everything's getting delivered. But what people are using it, and they don't realize all of the precautions that they have to take and the protections they don't necessarily have when they use those devices. So someone may say, oh yeah, I've started using it, I'm using it all over the place, but they were having terrible results on quizzes that showcase that they really did not know that they were not protected, and that once the money's gone, in many cases, it's gone forever. So, you need to know who you're sending things to, and not just sort of any old seller on the internet, for instance.
And you're talking about like the Cash App and the Venmo and things like that, that aren't necessarily a credit card type of protection, and that the buyer really needs to be aware that they're actually dealing with a known and credible vendor, and not just giving their numbers out to anyone.
Exactly. Yeah, you don't have the same protections as you do necessarily with your Visa, and other things. Just the fraud protections just aren't there to the same degree.
Right. Now, what about like just the experiences of residents in either the skilled facilities, assisted living, or even congregating? I hear a lot of constituents complain that not only are they being isolated, which is problematic because if they can't leave their room, they're not mobile, they're becoming much more sedentary, which is not good. If you don't work out, you're going to lose your ability to keep your muscles and the muscle memory, but also the lack of family members. That's the eyes and ears to many people, particularly with diminished capacity. What are you hearing in the field? That's what I kind of hear. Are you hearing the same thing?
Oh yeah. Yep. So I guess I would say that I think it was around March 13th that the public health order preventing visitors of any kind, including preventing some of the folks who do inspections and investigations into nursing home, was ordered. At first people
What are you hearing?
Seemed
in the field?
concerned
That's
about
what I
it. Like
kind of
family
hear.
members were
Are you
contacting
hearing
us.
the
They were
same
concerned, but I
thing?
think
Yeah,
like all of us
contacting us, they were concerned, but
kind
I
of
think
thought,
like
well,
all of us,
you know,
they kind of
what are we
thought,
looking
well,
at?
2-3 weeks,
what
we'll
are we
be out of
looking
this.
at?
2-3 weeks.
And then
we'll
it
be out
became
of this.
apparent that it was not going to be 2 or 3 weeks, and people started to become very concerned because they were not getting the information they needed or the access they wanted from their the nursing home that their family member was in. Now, I'll phrase this with some nursing homes, some assisted living facilities, off the bat, day one, is communicating almost as perfectly as possible with family members on the outside. Some weren't, and some still are not. So, you know, a lot of progress has been made in terms of communication, but people are still really upset, and they're upset because they are not able to do. Some places aren't doing anything other than virtual. Some are doing virtual visits, and they're doing at the window kind of thing, you know, but there's also people want to do gatherings outside. They want to be able to see someone face to face. You know it as well as I do, and some of your constituents probably know that the Department of Public Health, working with the state long-term care ombudsman and the nursing home trade associations, were able to use these funds, and I'm not going to remember what the name of the funds were, but use these funds to be able to buy 800 iPads and get them to nursing homes to start virtual visitations. And the governor put out an executive order at the same time saying that the visitations were now mandatory, and that they could be telephonic, virtual, window, et cetera. So people really felt much better after that. I'm told that there's still a couple of nursing homes that had to get really, they needed to be brought to the table a little bit this week. But the ability to see family has really increased, and people are much happier. But the visitation order for not being able to go in person is still in existence until September 1. And for many people, that means they will never see their loved one in person again alive. The only way you're allowed to go in right now is if it's at, you know, it's end of life, the very end of life. I've heard stories of people not being able to see their family member, getting called after passing. So obviously, while nursing home staff are under a great deal of stress and are doing tremendous amounts of work, families and residents are as well. They're under a great deal of stress. And so that's what we're really hearing. I'm not hearing from nursing home staff per se. I know you and your colleagues have been, but I am hearing from family members, and some of the stories are heartbreaking. We were able to do a lot of advocacy on that virtual visitation, and I think we had about 400 signatures on a petition for the governor and the Department of Public Health to go ahead and do that. But I think we are at a point where we're going to still need more action on the nursing home front, both in terms of visitation and a few other things.
Yeah, and I can't agree more. The particularly the extension of the order to September includes months like July and August, which we have heard from the experts and all the modeling are going to be the two best months of the year to not allow family members to see their loved ones, because in many cases when you have diminished capacity, they're your eyes and ears, the boots on the ground that are there to make sure that everything is done appropriately. And like you say, most facilities do a great job. And we hear from good facilities that do that, but they're like everything in life. Not everybody is always up to speed and to par. And so there are some facilities that need a little bit of help and guidance in regards to this.
Yeah, and
go ahead.
70% of the deaths from COVID-19 have been in nursing homes. And so even when you're doing the best job possible under the circumstances, it's clear that as a state and as a society, and this is across most of the country. I mean, it's very rare that the numbers aren't up like that. We need to do more.
Well, in case in point, I was actually watching an ABC news story yesterday. They were talking about a national average much more closer to like 30 or 40%. We're on the higher end at 70%. We're like in the top 3. Yeah. And so that's an issue that I think needs to be looked at as to how did we get there. but that's not for today. But at some point, once we get back into session, special session, we can start looking at some of those issues, because I think we need to know what's going to happen. The experts are saying that we're going to have a resurgence. It's probably the modeling saying October. Well, we have this experience from the spring. What's going to happen, and are we prepared? Have we put the proper protocols and safeguards in place? And that's where I think a lot of advocacy is going to need to come in to make sure that we protect not only the vulnerable population, but make sure that patient rights are protected. That's actually our first question, has to deal with patient rights and issues. And can I explain what rights patients and families have when it comes to seeing each other and communicating? With the executive order, a lot of the rights and responsibilities, there's a patient bill of rights that kind of got put on hold, especially when it comes to, I'm going to say, room reassignment and admissions and discharges. So those were put on hold. Obviously, the executive order says families can't come in. But what we need to do now is to start advocating to make sure that while you did yeoman work getting the virtual and the window, I think we can do more. And I think, as you mentioned earlier, we could start looking at if somebody's socially distanced outside, you have the proper safe protocols in place. We can move toward an outdoor and seeing person-to-person type of meeting, because they've been cooped up. Like I said, they're not getting mobility and fresh air and sunshine. Our moms always said, go out and get some more fresh air and sunshine, a little bit of vitamin D. That's not going to hurt anyone. And I think, after being cooped up in a nursing home for a couple of months, they could use some fresh air and sunshine.
Yeah, and think about how those of us that aren't in that kind of position in lockdown. We're all in lockdown to some degree, but I get to go to the grocery store. I get to go out for a walk. I get to, socially distance on my deck. Humans need that kind of interaction. And I am by no means an expert in nursing homes or in Alzheimer's or anything like that, but I've heard a great deal of concern from people about those with dementia or Alzheimer's, that were in need of having that connection that was keeping them healthy, that have sent them into a much faster deterioration than probably would have happened otherwise. So I'm with you. We are, we've always worked some on nursing homes, and I just didn't think it was going to be this much. I didn't foresee that this need would be here, and I don't think any of us could have. So, and just so everybody knows, we're also working on a lot of companion ideas like this at the federal level. There's something called the Access Act, which pretty much the whole House delegation from Connecticut is on board with and supportive. That provides funding for technology and telehealth that would also should be used for communication. We've got a lot in about CMS and what their rules are. There's also other things we're working on, like SNAP benefits, and worked very hard to ensure that Social Security recipients receive that $1,200 stimulus check. So everyone should know that AARP advocates on the federal level. And at the end of, it was about 3 weeks ago, we were all supposed to be in DC doing our, lobby week. And we all went virtual instead. So talking to members of Congress on both sides of the aisle on the exact same issues, and really, trying to make sure that they understood where people are coming from both the family caregiver side and the nursing home resident side. And, as well as just the insecurity. It's not like everybody who AARP represents is on Social Security either. We're age 50 and up for our membership, and some are significantly younger because they're married to someone 50 and up. We've got the same concerns about unemployment and, tax relief and all the other things that everybody else has. So, but yeah, everything is happening at the state and the federal level at the same time. But I expect we'll be talking a lot about nursing homes in what I hope is a special session that happens sometimes before the end of June. But if not, definitely into the next legislative session and beyond. And, I should mention in particular, you've been a long champion of the programs that help keep people out of nursing homes, the home care program for elders and the like. I mean, some of the cuts have happened to those that I would think we would really like to see reversed in order to, first of all, it's less expensive to stay at home. But second of all, people are going to be safer at home. So making sure that we protect, if not help build on some of those things.
Well, and particularly given the experience, the 70% number. I mean, that in and of itself is exhibit one,
Yep.
demonstrate the value of home care. And that, we need to look at, community-based services in a whole new light and give the proper funding. Because as you say, it's not only arguably better and what people want, but it's less expensive. This is one thing that, I scratch my head as a legislator. Why wouldn't we want to do what people want that's actually better and less expensive? I mean, it's something that we should be looking at and doing. And I've been advocating that for years.
Yes, you have.
Actually, this dovetails nicely. We got a question from Fran, and what she was asking about was the asset limit for the $1,200 stimulus check, and what does it mean to individuals who receive that? And the answer is, quite frankly, that for Husky, medical, MSP, AABD, which is aid to aged, blind, and disabled, and Saga Cash, it's treated as not countable as income, and you have up to a year before it's going to be counted as an asset. So right now, it will not. Those stimulus checks that we're advocating for people to get will not become an impediment to Medicaid or DSS eligibility and be counted as an asset only after you've held it for a year. So in those regards, I think people should be able to enjoy the benefit of this stimulus check, not be concerned about the impact on their assistance programs, and they have a year to keep it, to get it back down to within program limits. So that's the DSS little information moment there. So getting back to the, I'm going to say just the nursing home, one point that you raised was people with diminished capacity. And that's where it's so important that while we look at COVID, what I hear from a lot of families and caregivers is that we're missing the point. And that's why keeping people in their room, not having mobility, their muscles are atrophying, as well as not seeing the familiar face that normally came in and fed them. Now they don't know whether their family members are there. And when you shuffle people around to different rooms, you lose capacity. And that can be as dangerous to somebody's and as lethal to an individual as the COVID virus. And that seems to have been lost in the process here. And I think it needs to be brought forward so that when we go through this again, if we go through it again in the fall, more attention and detail is given to individuals that have diminished capacity in one way, shape, or form. Are you saying the same things?
I am. And I think one place that I've learned a lot is the long-term care ombudsman Facebook Live, Monday, Wednesday, and Friday. I think now-ish, 5:30, I think she does them, right?
Yeah.
So it's a difficult Facebook Live it's like LTCOP. But anyways, maybe somebody can figure out what it is and type it in the Facebook chat. But Mairead Painter, the long-term care ombudsman, I have spent a lot of time watching her Facebook Live that has built to a pretty significant audience and hearing what family members were saying. And a lot of it is what you just brought up, but a lot of it I picked up on over time seemed to me to be the vast amount of information coming out from both the feds and from the state on the rules of the road. I don't think nursing homes were expecting the National Guard to show up, and this is all a new world for everybody, right? And I know I have a hard time keeping up with the, rapid fire amounts of information and ever changing situation. But What did seem to me to be a big problem was a pretty continuous misinterpretation by staff. Maybe it didn't get down from the corporate office well enough. I'm not sure about what you can do within the walls of the nursing home. So for instance, some hearing from multiple family members that people weren't allowed to open their windows, right? I mean, so like the simplest thing on a nice spring day, which wasn't true. That wasn't ever the guidance. Now, not if there's someone on the other side of it visiting you, right? But, or that doors had to be closed under all circumstances to rooms, so when we think about, and, everybody crossed their fingers, not a resurgence and not this problem again, but how do we communicate clearly so we don't make the problem worse than it has to be inside of the nursing home? Because I think it's just the constant drumbeat of information. If there's a learning to be done from this, in addition to the medical and the science behind it, like how do we communicate in a way that allows for the best possible quality of life under extraordinarily difficult situations? And anyway, I don't know the answer to that, but when you sit there on those calls, those Facebook Lives, for 10 weeks, you start to pick up on a few trends.
Right.
And this information is
Exactly. Our last question so far comes from Peggy, and it has to deal with seniors who might not be as knowledgeable on things like smartphones, Kindles, and Facebook, who use the actual libraries for their source of information and books and reading. Is there anything that you could recommend that might be a way for them to seek information and materials?
so.
Until libraries aren't supposed to open until June 20th as part of phase 2. So we're about a month away.
That being said, the one thing I do know is that some towns, and I don't know where this person who wrote this in is from, but for instance, I know the Bloomfield town library, for instance, has been doing curbside pickup for books with a protocol in place for probably 6-8 weeks. I saw one of your colleagues, and I get a lot of your colleagues, regardless of where I live, newsletters. And Senator Derek Slapp had in his newsletter yesterday that the Avon Public Library was starting curbside pickup. So I have a feeling that there might be more opportunity here than the questioner has in mind. That being said, I don't know town by town. So obviously, as long as nothing goes awry between now and then, it's the June 20. But I think it might be possible to find, maybe the Connecticut Library Association has a list of who's doing curbside pickup. I also think some senior centers have helped develop some programs that do delivery. Otherwise, it makes a bad situation worse for people who spend a lot of their time, for instance, reading, and don't use the technology in the same way.
Right.
But I think some research might get to some solutions faster.
Yeah, and also they should check with their local library, see what's going on, maybe the surrounding communities, see what they have, and whether or not there's anything anything available like curbside pickup in their own community.
Yeah.
So we don't have any other questions. Do you have anything else before we wrap up?
Sure. So we kicked off today. Now I'm going to find my notes. We kicked off today in Connecticut Webinar Wednesday. So trying to get back to some of our regular programming that we would do at the library, at the community center, maybe at the church, etc. Every Wednesday at 1 p.m. for a few weeks out, AARP.org/CT, we have a little events widget. We have a webinar. So today was about caregivers. Next week is about understanding what you need to know about your electric choices. We have a very complex third-party electric supply market in Connecticut. So we ask people to bring their bill to the webinar and go through and figure out, what their rights are. Are they paying what they should be paying? what do they need to look at, and just understanding it. Then we have one coming up on Connecticut's new paid family and medical leave program, and then one on our AARP Fraud Watch Network. Again, getting into the issue of keeping your money in your own pocket and not falling for frauds and scams. We're going to air a film documentary called Gen Silent on June 18th. That is about aging as an LGBTQ person, and sometimes feeling like you're being pushed back in the closet as you age, and maybe have to go into residential care. And then we have a Livable Communities Conference coming up. Then also there's some things from my national office, like our AARP Movies for Grownups on Facebook, and other items like, understanding Medicare, if you're approaching Medicare eligibility, what you need to know, what you need to understand, and then some webinars for job seekers and the like. So aarp.org/CT. Anyone's welcome. They're all free. And we're going to start a little library so you can watch them on demand later. But we just kicked off today. So our brave new folks.
Cutting edge news, and it's a great advocacy and great benefit and resource to many individuals. So thank you for doing that. Also, thank you for being with us here today. This I think is very informative for individuals. And if they would like to continue watching, we have posted in the comments to this video the link to the Ombudsman, who started her Facebook Live at 5:30. So you can go there and watch that. That's another opportunity to see some more information on the current topics going on currently. So thank you, everybody that watched. Thank you, Nora, for everything, you not only being here today, but everything that AARP does on behalf of the people of Connecticut. As you detailed, you do a lot of advocacy both here and in Washington to make sure that seniors and their interests are protected. So thank you very much. And thank you to everybody that wears a red shirt at the Capitol. We do appreciate that, and it makes a difference. So thank you.
Thank you for having me.
Take care.
All right. Bye-bye.